Health Matters is sponsored by Mount Carmel.
There's three main types of skin cancers: basal cells, squamous cells, and melanomas. By far, basal cells is the most common, usually presents as a pearly macule and oftentimes bleeds by itself. Where squamous cells is the second most common. It tends to be more ulcerated. Melanoma is the third type of skin cancer, which is the worst, which can metastasize. Early treatment is the key, because once it metastasizes, it's difficult to treat. The people at most risk for developing skin cancer are what we call Fitzpatrick 1 skin types, where they rarely ever tan. They burn easily. They tend to have blue eyes, blonde or red hair, and are fair complected. But you can get skin cancer even in darker individuals. The more sunburns you get, the more likely you are to develop skin cancer later in your life. And it's very important in younger ages, because that's when you get the most sun damage and sun exposure. The ways to avoid sun exposure is obviously using sunscreens, covering your arms and legs, staying in the shade, especially between the hours of 10 and 2. Use a wide brim hat. Try to use sunscreens, especially on the top of the ears and the nose areas. If you do see anything concerning, or if you think you may be at risk of developing skin cancer, contact a primary care doctor right away, because your health matters.
Health Matters is sponsored by Mount Carmel.